Vitamin C. Vitamin C.
Today, today is a World Hypertension Day. Hypertension is a very dreadful disease. It is a silent killer of mankind. So, if you see, the magnitude is very high. The global burden of this disease is very high. Most of the people get this disease throughout their life period. If you see three patients, out of the three patients, one person is having a high blood pressure. It doesn't mean that, because the problem is that people go to doctors when they have some problem. They don't screen themselves. If you screen three people, out of the three people, one will be having hypertension. So the biggest enemy of mankind is hypertension. So what we have to do, we have to screen all our whosoever comes to the hospital. We cannot screen the whole world, but whosoever comes to the hospital, it is our duty to check his blood pressure if he comes from some other problem. So if you see those people who are already labeled as hypertensive, out of these, if you see 100 people, out of the 100 people, only 25% of the people have their blood pressure is under control. The rest of the people do not have their blood pressure under control. So what we have to do, we have to advise these people, change their lifestyle, number one. Number two, we have arbitrary cutoff why to treat, when we have to do drugs. So lifestyle is to be changed. It means that they have to take restricted salt intake. It should be reduced to 4 grams, half of the salt, because in Kashmir we see that most of the people take salty. We have to tell them to take this salty. And some rotis, bread, they add that salts with them. So we have to ask them, take a good diet, salt restricted diet. Number two, take a lot of fluids. Third, that fat intake is to be reduced. Fourth is, ask them to have regular exercise, at least 30 to 45 minutes, 5 days a week. And another, suppose there is a other group of the people where we see that the blood pressure is very high, we give them directly drugs. So we have to make sure that they don't take only drugs. Their blood pressure should be under optimal control. So always tell them, have a healthy lifestyle. Wherever It will not kill you unless and until you don't treat it. So have a optimal control of their blood pressure. Take drugs regularly. It is not that they take blood pressure drugs, afterwards when the blood pressure comes to normal, they leave the drugs. It again shoots up. So they have to be with these drugs lifelong. So all the best for all the people. So my message to all the people as a professor of cardiology is, whosoever is resident here, whosoever comes to the hospital, at least check his blood pressure reading 3 times. 3 times in all the limbs: upper limb, right upper limb, left upper limb, and left lower leg. So you, in this way, you will do a commendable job. You will screen the people, you will screen your population. So don't leave anybody without measuring the blood pressure. Number 2, second advice, have a healthy lifestyle. In Kashmir, those will ask them to reduce the salt intake, because in Kashmir I have given many talks on the TV and radio. I have asked them have a healthy lifestyle, because a lot of the people take here a lot of salt, particularly salt tea. Number 2, that tandoori roti, or that what is called that, what they also add some bicarbonate in them, just for I don't know what for reason. Number 3 is have a healthy lifestyle. Healthy lifestyle, saturated fats to be reduced, a lot of fluids to be taken, at least 1 to 2 liters of fluid every day. Have a regular exercise, and if the doctor advises you drugs, please take them drugs, take regularly, unless and until doctor asks them to withdraw it or reduce the dose. That's all. Main cause of hypertension is, the first thing is that hypertension as such, most of the people get hypertension during their life period. If you see 100 people, 90% of the people will get hypertension throughout life period. What I have to say, it is a disease of aging. See, most of the people. Number 2 is here, dietary habits, lot of salt intake. 3rd is inactivity. 4th is, you know, the lot of people are under stress. Stress is a very important cause of hypertension. So most important is that lifestyle, if you have a sedentary lifestyle. Number 2 is the sedentary lifestyle. Number 3 is dietary bad habits, that take a lot of salt, saturated fats. Physical inactivity is 3rd. And 4th is, with the age, most of the people get blood pressure, as I told you, 90. 4th is genetics. So other things we can change, genetics we cannot change. But the most important thing is that you screen yourself from 18 onwards, check your blood pressure regularly. If there is a blood pressure, take blood pressure drugs, you will be all right.
आज वर्ल्ड हाइपरटेंशन डे है 7 में, तो प्रधानमंत्री जन औषधि परियोजना की तरफ से आज हम सुपर स्पेशलिटी में फ्री मेडिकल कैंप हमने ऑर्गेनाइज़ किया है, जिसमें हम अराउंड अबाउट 100 पेशेंट्स का फ्री मेडिकल चेकअप करेंगे, और कुछ मेडिसिन्स हमारी जन औषधि की फ्री भी दे रहे हैं, डिस्ट्रीब्यूट कर रहे हैं। और ये थ्रू आउट कंट्री हम सेलिब्रेट कर रहे हैं, और उसके लिए आई एम वेरी मच थैंकफुल टू द मेडिकल सुपरिटेंडेंट एंड द डिप्टी मेडिकल सुपरिटेंडेंट एंड द अदर अथॉरिटीज़ ऑफ द सुपर स्पेशलिटी हॉस्पिटल, जहाँ पर हमारा ऑलरेडी जन औषधि केंद्र चल रहा है, जिन्होंने हमें आज ये अपॉर्चुनिटी दी कि उनके हॉस्पिटल में हमें मेडिकल कैंप करें, एंड दे हैव सपोर्टेड अस अ लॉट। थैंक यू वेरी मच।
तो फ्यूचर में क्या कोशिशें रहेंगी जन औषधि की?
फ्यूचर में अभी हमने 227 केंद्र हमारे हैं इस टाइम। आने वाले टाइम में कुछ 75 केंद्र हम ओपन मार्केट में खोलेंगे, और जिसके लिए हम आज से ही काम कर रहे हैं। काफ़ी परमिशन, NOCs एंड लेटर्स हम दे चुके हैं, इशू कर चुके हैं, और बाय एंड ऑफ दिस ईयर वी मे टच 275 केंद्रास इन द स्टेट ऑफ। देखिए, हर एक काउंटर जहाँ जहाँ पे होगा, हॉस्पिटल की अपनी डिमांड होती है, मार्केट की अपनी डिमांड होती है, तो हम हर एक काउंटर पे सारी मेडिसिन तो रख नहीं पाएंगे ना। जो वहाँ की लोकल डिमांड होगी वो हम उसको कवर करेंगे। अगर आज आप हमारा जन औषधि केंद्र, सुपर स्पेशलिटी या टर्शरी केयर हॉस्पिटल या डिस्ट्रिक्ट हॉस्पिटल में देखेंगे, वहाँ डिमांड अलग है और मार्केट की जो डिमांड है वो अलग है। तो हमको आज की डेट में हमारे पास बास्केट 1800 मेडिसिन का है, लेकिन 1800 मेडिसिन एक केंद्र पे रखना पॉसिबल नहीं है, उसमें एक्सपायरीज भी है, वो भी एक इशू है। लेकिन जो जहाँ की डिमांड है, हॉस्पिटल की है या मार्केट की है, वो हम पूरी कर रहे हैं एज़ पर द रिक्वायरमेंट ऑफ द पेशेंट।